High blood pressure, often referred to as hypertension, has long been considered one of the most pervasive health challenges worldwide. It is a condition that silently wreaks havoc on the body, increasing the risk of heart disease, stroke, and kidney failure. Despite its prevalence, the medical community has largely treated hypertension as a standalone issue, prescribing medications to manage symptoms rather than addressing the underlying causes. This approach has led to a system where patients are often left dependent on lifelong drug regimens, with little attention paid to the root problem. However, recent insights have begun to shed light on a shocking reality. The majority of hypertension cases are not random or unexplained but are instead deeply tied to one specific factor: insulin resistance. Insulin resistance, a condition in which the body's cells become less responsive to the hormone insulin, has emerged as the primary driver of high blood pressure in a significant number of cases. This revelation challenges the conventional narrative that labels 90% of hypertension cases as having an unknown cause. The implications of this discovery are profound, as it suggests that much of the burden of hypertension could be mitigated through targeted lifestyle changes rather than reliance on pharmaceutical interventions. By understanding the intricate relationship between insulin resistance and blood pressure regulation, it becomes possible to unlock new pathways for prevention and treatment. At the heart of this connection lies the endothelial layer of the arteries, a delicate lining of cells that plays a crucial role in maintaining vascular health. Embedded within this layer are tiny receptors for insulin, which, when activated, trigger mechanisms that help relax the arterial walls. This relaxation is essential for maintaining normal blood pressure levels. However, when insulin resistance sets in, these receptors become damaged, impairing their ability to function properly. As a result, the arteries lose their capacity to relax, leading to increased tension and elevated blood pressure. This damage creates a cascade of problems, including excessive calcium buildup within the cells, which further exacerbates the condition. The use of calcium channel blockers, a common class of medications for hypertension, underscores the importance of addressing this calcium imbalance, yet it often fails to tackle the root cause of the issue. Another critical component in this equation is the glycocalyx, a protective layer that coats the endothelial cells. Often likened to a non-stick surface on a frying pan, the glycocalyx serves as a barrier against damage and inflammation. When this layer is compromised, the endothelial cells become vulnerable to harm, setting off a chain reaction of adverse effects. Excessive glucose and fructose in the bloodstream can erode the glycocalyx, much like acid rain corrodes a surface. Once this protective shield is weakened, the arteries are left exposed to oxidative stress, inflammation, and the accumulation of calcium deposits. These changes not only contribute to hypertension but also pave the way for more severe cardiovascular complications. The role of dietary choices in damaging the glycocalyx cannot be overstated. Modern diets, laden with processed sugars, refined carbohydrates, and unhealthy fats, create an environment ripe for insulin resistance and glycocalyx degradation. Consuming high amounts of sugar and starch leads to spikes in blood glucose levels, which, over time, wear down the protective glycocalyx. This process is particularly concerning given the widespread consumption of sugary beverages, processed snacks, and fast food in today's society. The result is a perfect storm of metabolic dysfunction that fuels the rise of hypertension and other chronic conditions. Addressing the root cause of hypertension requires a multifaceted approach that goes beyond simply reducing salt intake or taking medication. Nutrient deficiencies, often overlooked in conventional treatments, play a pivotal role in the development and progression of high blood pressure. For instance, vitamin D, a nutrient that has garnered significant attention for its immune-boosting properties, is also essential for repairing the endothelial layer. Deficiencies in vitamin D are common, particularly in regions with limited sunlight exposure, and can hinder the body's ability to maintain healthy blood vessels. Restoring adequate levels of vitamin D is therefore a critical step in reversing hypertension. Magnesium, another vital nutrient, works synergistically with vitamin D to promote vascular health. This mineral is known for its ability to counteract the effects of calcium, helping to prevent excessive contraction of smooth muscle tissue in the arteries. Magnesium also possesses anti-inflammatory properties and helps regulate stress hormones like cortisol and adrenaline, both of which can contribute to elevated blood pressure. Unfortunately, magnesium deficiency is prevalent due to poor dietary habits and soil depletion, making supplementation necessary for many individuals. Choosing the right form of magnesium, such as magnesium glycinate, ensures optimal absorption and effectiveness. Potassium, often overshadowed by its counterpart sodium, is another key player in blood pressure regulation. This electrolyte helps balance sodium levels in the body, preventing water retention and reducing strain on the cardiovascular system. Potassium also directly relaxes smooth muscle tissue, promoting healthier blood flow. While bananas are commonly associated with potassium, other rich sources include leafy greens, avocados, and certain types of fish. For those who struggle to meet their potassium needs through diet alone, supplements can provide a convenient solution. Sulfur, a lesser-known but equally important nutrient, plays a unique role in rebuilding the glycocalyx. Found abundantly in foods like grass-fed red meat and eggs, sulfur provides the building blocks necessary for restoring the protective layer around the endothelial cells. Contrary to outdated beliefs that cholesterol-rich foods should be avoided, these sulfur-rich options offer substantial benefits for vascular health. Eggs, in particular, have been vindicated in recent years as a nutrient-dense food that supports overall well-being, including blood pressure management. In addition to addressing nutrient deficiencies, adopting a low-carbohydrate diet and practicing intermittent fasting can yield dramatic improvements in blood pressure. Carbohydrates, especially refined ones, are a major contributor to insulin resistance and glycocalyx damage. By reducing carbohydrate intake, individuals can stabilize their blood sugar levels and improve insulin sensitivity. Intermittent fasting takes this approach a step further by giving the body extended periods to repair and regenerate. During fasting, insulin levels drop, allowing the body to burn stored fat for energy and reduce inflammation. Together, these dietary strategies create a powerful foundation for reversing hypertension. While dietary changes are paramount, managing stress is equally important in achieving optimal blood pressure levels. Chronic stress activates the sympathetic nervous system, which can elevate systolic blood pressure, the top number in a blood pressure reading. Practices such as mindfulness meditation, deep breathing exercises, and regular physical activity can help calm the nervous system and promote relaxation. Sleep, often neglected in modern life, is another cornerstone of stress management. Prioritizing restorative sleep not only lowers blood pressure but also enhances overall resilience to stress. Monitoring progress is a crucial aspect of any hypertension management plan. Home blood pressure kits provide a convenient way to track changes over time and assess the effectiveness of interventions. Regular monitoring allows individuals to identify patterns and make adjustments as needed. For example, If the diastolic pressure, the bottom number, improves but the systolic remains elevated, it may indicate the need for additional focus on stress reduction techniques. It is worth noting that the journey to lowering blood pressure is not always linear. Some individuals may experience rapid improvements, while others require more time to see results. Patience and consistency are key, as the body needs time to heal from years of metabolic dysfunction. Avoiding hidden carbohydrates, such as those found in processed foods and sauces, is also essential to maintaining progress. Keeping a detailed food log can help identify potential pitfalls and ensure adherence to a low-carb lifestyle. The broader implications of addressing insulin resistance extend far beyond hypertension. By tackling this underlying issue, individuals can reduce their risk of developing other chronic conditions, including type 2 diabetes, obesity, and heart disease. Moreover, the economic burden of treating these conditions could be significantly alleviated if more emphasis were placed on prevention rather than symptom management. Empowering people with the knowledge and tools to take control of their health has the potential to transform healthcare systems and improve quality of life on a global scale. In conclusion, the revelation that insulin resistance is the primary cause of high blood pressure represents a paradigm shift in how this condition is understood and treated. By focusing on repairing the endothelial layer, restoring the glycocalyx, and addressing nutrient deficiencies, it is possible to reverse hypertension naturally and effectively. Combined with a low-carbohydrate diet, intermittent fasting, and stress management techniques, this holistic approach offers hope for millions of individuals struggling with high blood pressure. The message is clear: hypertension is not an inevitable consequence of aging or genetics but a symptom of modern living that can be overcome with the right strategies. So, there you have it, the truth about what's really driving high blood pressure and how you can take control of your health naturally. By addressing insulin resistance, repairing the glycocalyx, and focusing on key nutrients like vitamin D, magnesium, potassium, and sulfur, you have the power to reverse hypertension without being dependent on medications for life. Pair these strategies with a low-carb diet, intermittent fasting, and stress management, and you're setting yourself up for success. If you found this information eye-opening, make sure to give this video a thumbs up, share it with someone who needs to hear this, and subscribe to the channel for more life-changing health insights. Thanks for watching.